As a veterinarian with years of experience treating brachycephalic breeds, I have encountered numerous cases of pugs suffering from breathing difficulties due to their unique anatomical structure. One particular case that stands out is that of Archie, a lovable pug who came to our clinic with significant respiratory issues. Archie, a 3-year-old pug, was brought in by his concerned owners who noticed that he had been experiencing labored breathing, especially during physical activity and in warmer temperatures. They reported that he would often snore loudly, even when awake, and seemed to tire quickly during walks. These symptoms are characteristic of Brachycephalic obstructive airway syndrome, BOAS, a condition commonly seen in flat-faced breeds like pugs, bulldogs, and French bulldogs. Upon examination, we observed that Archie had stenotic nares, meaning his nostrils were abnormally narrow, restricting airflow. Additionally, he had an elongated soft palate, which was partially obstructing his airway. These anatomical abnormalities are congenital and contribute significantly to the breathing difficulties seen in brachycephalic breeds. Given the severity of Archie's condition, we recommended surgical intervention to alleviate his breathing problems. The proposed procedures included widening his nostrils, nares resection, and shortening his elongated soft palate, staphylectomy. These surgeries aim to reduce airway resistance and improve airflow, thereby enhancing the dog's quality of life. Archie's owners were understandably anxious about the surgery, but after discussing the potential benefits and risks, they agreed to proceed. The surgical procedures were performed without complications, and Archie was closely monitored during his recovery. Post-operative care included pain management, antibiotics to prevent infection, and restricted activity to allow proper healing. Within a few weeks, Archie's breathing had improved dramatically. He no longer snored while awake, could engage in longer walks without tiring, and seemed more energetic and playful. His owners were thrilled with the outcome and expressed gratitude for the positive change in Archie's quality of life. This case highlights the importance of recognizing and addressing the health issues associated with brachycephalic breeds. While their distinctive facial features may be endearing, they often come at the cost of the animal's well-being. Surgical intervention, when appropriate, can significantly enhance the quality of life for these dogs. When Archie returned for his 2-week post-operative checkup, his transformation was already noticeable. He greeted the staff at the clinic with the same wagging tail, but there was a lightness in his movement that hadn't been there before. His breathing was quieter, less strained, and his eyes no longer carried that constant subtle look of discomfort he'd worn before surgery. He seemed relieved, and that's when I knew we'd done something profoundly meaningful for him. Archie's recovery, while clinically smooth, was not without its small challenges, ones that are familiar in any post-operative care for brachycephalic obstructive airway syndrome, BOAS. After surgery to correct stenotic nares and reduce the elongated soft palate, it's not uncommon for swelling in the throat to temporarily affect breathing or eating. Archie, in his ever-stoic way, had a mild bout of throat irritation. He gagged slightly more for the first couple of days but was quickly managed with anti-inflammatories and careful monitoring. One of the key elements we emphasized with Archie's owners, Lisa and Ben, was how vital it would be to prevent overexertion in the early healing phase. Pugs are social, spirited little creatures. Archie, though mellow in some ways, still carried the same instinctual urge to bound after birds or trot after neighborhood dogs during walks. We set strict limits for activity, recommending very short leash walks and no off-leash time for 3 full weeks. Lisa admitted later that it had been harder to restrict Archie's movement than it had been to manage the surgery itself. By the 4-week mark, we began to see not just improvement, but the possibility of a life Archie had never fully experienced before. The respiratory stridor, a high-pitched wheezing noise, that had characterized so many of his days was all but gone. He still had a few soft snores while sleeping, but they were nothing compared to the grating gasps that used to worry his owners awake at night. He had more energy, more stamina on walks, and his recovery was not just physical, but emotional too. Archie appeared calmer and more confident, as if the constant underlying stress of struggling to breathe had finally lifted. I remember vividly one appointment in particular, about 2 months after surgery. Lisa brought Archie in on a bright spring morning. His coat looked shinier, his weight had dropped slightly, which helped his breathing even more, and he walked into the clinic with a loose, joyful stride. Lisa said something that stuck with me: "He finally acts like a normal dog." And while I understood what she meant, it also reminded me that Archie had never really had a normal life until then. This is a recurring experience with BOAS cases. We often don't realize just how compromised a dog's quality of life is until after intervention. Owners become accustomed to the snorting, the fatigue, the strange sleep postures. They learn to interpret their pug's inability to keep up on walks as simply being lazy or not into exercise. But the truth is often more serious. These dogs are suffocating in slow motion. And unless we address the anatomical obstructions, we're asking them to survive in discomfort. One of the common misconceptions is that surgery is drastic or dangerous. The truth is, while it's not without risk, especially under anesthesia in brachycephalic breeds, it's far safer than letting a dog live in chronic respiratory distress. At our clinic, we use advanced monitoring protocols, pre-anesthetic blood work, and an experienced anesthesia team familiar with the needs of pugs and bulldogs. The surgical procedures themselves are now refined, a combination of wedge resections of the nares and careful trimming of the soft palate to prevent over-resection, which can cause other complications. Post-Archie, I've often used his case when educating new pug owners or fellow veterinarians. His before and after was so clear and profound, and he served as a reminder of what good medicine can accomplish. His story also sparked deeper conversations with Lisa and Ben, who had always loved pugs but were now aware of the ethical implications of breeding for extreme features. They told me that Archie had come from a breeder who assured them that snoring was normal for pugs, that the labored breathing was just how they are. This infuriated me, not because of their naivete, they were loving, conscientious owners, but because this type of misinformation is still rampant. Brachycephalic breeds have been bred over time to prioritize appearance over function. Flattened faces may look cute, but they severely compromise upper airway anatomy. What's more, BOAS isn't always immediately obvious in puppies. Symptoms often worsen with age, weight gain, or heat exposure. It's why education is so essential, both for prospective dog owners and breeders. After Archie's experience, Lisa and Ben became advocates in their community, sharing his story on social media and encouraging others to ask hard questions before choosing a breed or breeder. 6 months after Archie's surgery, he came in for a wellness exam. I barely recognized him. His weight was stable, his coat glossy, and most impressively, his respiratory rate was normal at rest. No nasal flare, no chest heaving, just the quiet, content breathing of a dog finally at ease in his body. I've worked with hundreds of brachycephalic dogs, but Archie's journey left an imprint. Not just because of how far he came, but because it reminded me why we do what we do. Every day, we meet animals who can't explain what they're going through. They don't understand anatomy or airway dynamics. They only know discomfort. And when we make a change that gives them ease, we witness something remarkable, not just recovery, but rebirth. To this day, Archie's case is one I reference during consultations. He's the example I share with owners who are on the fence about surgery. Not as a sales pitch, but as proof that with the right care, these dogs can live fuller, freer lives. The last time I saw Archie was nearly a year after his surgery. He came in for a routine dental cleaning. He trotted through the clinic doors, tail wagging, tongue lolling happily, no sign of labored breathing. Lisa bent down to unclip his leash and said, "He doesn't even snore when he naps on the couch anymore." We both smiled, because we knew Archie wasn't just breathing better. He was finally living better.